Here is the answering ARDMS OBGYN questions, the easiest learning for fetal lie and presentation. The easiest way is first, in sagittal, determine fetal head and spine. If the fetal head is down and the baby is in vertex and fetal spine or back is in the right side of the mom, and the baby is looking at the left side of the mom, so the left hand is anterior, the left shoulder is near the transducer. Or if the stomach 3 or 9, we will explain in the next slide. In this image, assume that the baby is situs soletus, the abdominal transverse. What is the presentation? So here we have the transverse of mom and transverse of the baby. Both of them are transverse. So which one is correct? What is the presentation? Breech, vertex, transverse head, left side of the mother, transverse head, right of the mother. It means head in left side or right side of the mom. Yes, so very good. It is breech. And how do you know that? Here we have the transducer in transverse and mom right and mom left. And the baby is in transverse too. Imagine the spine of the baby, these three spots is 12. So what is the position of the stomach? 1, 2, 3, 4, 5, 6, 7, 8. The stomach is 9. So if the stomach is 9, it is breech, and both in transverse or transverse view or in transverse image, so it is breech. Here we have the spine at 12 o'clock. So we have 1, 2, 3, 4, 5, 6, 7, 8, and stomach and at 9. So it is breech. And we have here the red one, umbilical vein, that is full nutrient and oxygen. And because of that, we showed here in red. From mother, all oxygenated to the liver and then the heart and brain. So it is full of nutrient in umbilical vein, not artery. And we have only one umbilical vein, but two umbilical arteries. The green one is gallbladder. Gallbladder is at the right side, and the umbilical vein curved to the right side of the baby, and the back of that is toward the stomach. And this is placenta, myometrium, and amniotic fluid that actually on ultrasound it is black, but here it is white. The next question, if the baby is in satis solitus, which with this transverse image, what is the presentation? Yes, we see here the mom and the baby both in transverse. So we see the stomach and the spine. So the stomach is in 3 o'clock and it is cephalic. Excellent. It is very simple. If the stomach is at 3 o'clock and the mom and the baby is transverse and the spine is on the left side, So the back is on the left side, and the baby is looking at the right side of the mom. So this one is the right shoulder or right hand. This side is the left hand and left shoulder. So left shoulder and stomach are together. So the baby is satis solitus, and the stomach in 3 o'clock, it is vertex or cephalic. If we do not know cytosolitus, mean organs or stomach and heart on the left normal position, we cannot determine, and we should use the longitudinal or spine first, and then when the inland or sagittal, the spine is at the left side of mom, so the baby is looking at the right side. The right side of the baby is anterior near to the transducer. So please pay attention to the satis solitus sentence. So it is very important. Easy learning, but satis solitus is a part of examination that we determine right side of the body. You know, your right hand is always determined at your right side, and left hand in your left side. But our organs inside the body is different. Maybe one in 10,000 people, 1% stomach is in the right side. So solitus is different from right hand and left hand. My determining way is when I find the spine of the baby, I think that it is the back. So the front of the baby is toward the right of mom. So the right hand is anterior and near the transducer. And left shoulder, vice versa. If the spine is at the right of the mom and the baby is looking at the left side, so the left hand or left shoulder is in front of the transducer. So in this sagittal image of mother abdomen, here is head of mom, sagittal, and lower limb of mom. In a fetus with situs solitus, what is the presentation of the baby? Anterior mom, superior, posterior. Excellent. How do you know that? That the head of the baby is at the right side of the mom. See here, what is the position of stomach and the baby is satis solitus? 3 o'clock. If the baby is 3 o'clock, the stomach is at 3 o'clock, it is in the right side, like vertex or cephalic. So with situs solitus, stomach 3 o'clock, like these two images, stomach 3 o'clock here and stomach 3 o'clock here, spine, spine. But the difference between these two images, this is in transverse, both in transverse. This is in sag. Mom is in sag, but the baby is in transverse. Here transverse, here transverse, but it is perpendicular to axis of mom. So the baby is in transverse. Head is at right or left. If the stomach is in 3 o'clock, it is in the right side. The first question is the longitudinal of the baby parallel to longitudinal of mom. If it is yes, so the baby is cephalic or breech. It is breech and this is cephalic. Mom head, mom baby. If it is no, longitudinal of mom is not with longitudinal of the baby, so the baby is transverse, head right side of the mom or head left side of mom. Please answer this question very carefully. Yes, excellent.